Hi everyone, welcome to our Genesis webinar. This presentation is for educational purposes only. Please consider your own situation and safety concerns before putting into practice any of the ideas that we talk about today. Some Genesis webinar safety. Please be sure to watch this in a safe place where only safe people can hear it. Remember to clear your browser history after watching the video if someone monitors your phone or computer. Using headphones can help ensure no one else can hear what you are watching. If you need to leave the live Zoom webinar quickly, remember that you will need to click End a couple of times and then close the Zoom page. Genesis Webinars Confidentiality. Please do not use the chat feature on Zoom. If you use the chat feature, your name and comment will be seen by anyone watching the live video and the video recording on YouTube. If you leave any comments on the YouTube video recording, your name and comment will be seen by everyone else who watches the video. Genesis Webinars Crisis and Support. If you are in a crisis, need help with emergency safety planning, or are looking for emergency shelter due to domestic violence, please call our 24-hour hotline at 214-946-4357. If you'd like to sign up for counseling at Genesis or want to talk to a counselor about your situation, please call 214-389-7700. Genesis webinar questions. If you have any questions about anything that is said in today's webinar, please contact the counselor or advocate who led this webinar. Their names and contact information will be at the end of the webinar. We do not monitor or respond to any comments or questions left on the YouTube video recordings. Please contact us directly if you need any help. Hotlines. Genesis Women's Shelter and Support. Our 24-hour hotline number is 214-946-4357. The number for the National Domestic Violence Hotline is 800-799-7233. The number for the National Suicide Hotline is 800-273-8255. Thank you for watching. My name is Jennifer Garcia. I will be presenting today. My phone number where you can reach me directly is 214-389-7755. If you would like to contact me via email, my email is jgarcia@genesisshelter.org. Hi everyone, my name is Jennifer Garcia. I am one of the residential bilingual client advocates here at Shelter. Today we will be going over medical information and community resources. For today's presentation, we will be covering a few main topics. The first one is domestic violence and impact on a woman's health. The second topic we'll be covering is COVID-19 information, medical resources, and safety planning around medical appointments. For the first section, we will be going over domestic violence and its impact on a woman's health. For this section, we will go over what domestic violence is and how to ask for help when you are going to a medical appointment. For this section, I will briefly go over what domestic violence is and how it may impact your access to much needed medical care. So what is domestic violence and how does it impact my health? Domestic violence occurs when one person in an intimate partner relationship exercises power and control over the other through a pattern of intentional behaviors. So what is intimate partner violence? The definition for intimate partner violence states that these are behaviors within an intimate relationship that causes physical, sexual, or psychological harm, including acts of physical aggression, sexual coercion, psychological abuse, and controlling behaviors. Domestic violence is the systematic diminishment of a woman in her own home. The types of violence can include verbal, emotional, physical, and sexual. In addition to the immediate trauma caused by abuse, domestic violence contributes to a number of chronic health problems, including depression, alcohol abuse, substance abuse, sexually transmitted diseases, including HIV and AIDS, and often limits women to manage their chronic illnesses such as diabetes and hypertension. Did you know that 1 in 4 women in the United States will experience domestic violence during her lifetime? 3 women in the United States are murdered by their partners every year. 1 in 6 women in the United States have survived attempted or completed sexual assault. 15 million children are exposed to domestic violence each year. Here are a few more facts on the impact of violence on a woman's health. Did you know that studies show that violence in women contribute to morbid obesity and disturbed eating patterns? Women who experience intimate partner violence are more likely than non-abused women to use tobacco. Victims of violence were significantly more likely to use multiple substances before and during pregnancy than women who have not experienced intimate partner violence. Female victims of intimate partner violence are generally less likely to access preventative and injury-related healthcare compared to non-abused women. Women in abusive relationships are often forced or coerced into unwanted sexual activity. This can impact their ability to care for their reproductive health. Female survivors of intimate partner violence are at an increased risk for suffering serious mental health problems that can continue years after the abuse has ended. Due to factors including lack of insurance and controlling partner behaviors, children of mothers experiencing abuse are less likely to complete immunizations. If you'd like more information on domestic violence, please reach out to your counselor or advocate. So how can you ask for help during your medical appointments? Women who have talked to their healthcare provider about experiencing abuse were 4 times more likely to use an intervention. When your partner is abusive, chances are that you don't get a lot of alone time. One common and effective tactic of emotional abuse is isolation. If your partner has isolated you from your family, friends, and community, your doctor may be the only person you have the chance to speak with alone. So be honest about the abuse you are experiencing with your healthcare provider. It is their job to take care of your physical and mental health. A way that you can talk to your doctor about the abuse that you're experiencing is by asserting your right to privacy during your medical appointment. Most doctor offices will follow their patient's lead as to whether it is okay for a partner to be present during consultation. However, we know that this may not be easy. Asserting your right to privacy can make you less safe when you leave the appointment, so always trust your instincts and your own personal situation. You can reach out to your doctor before your visit and let them know that you would strongly prefer if they could tell your partner they have to speak with you alone. Many doctors are starting to screen for intimate partner violence in their initial intake with patients. So if you get a moment alone with your doctor, be truthful of what you are experiencing. Medical providers are required to report to law enforcement. If you are afraid of involving the police, speak in hypotheticals, such as, what kind of help is there if I know someone who is being hurt by their partner? This part of the presentation will cover COVID-19 information. the symptoms to look out for, and tips to avoid exposure. People with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms appear 2 to 14 days after exposure to the virus. Those with the symptoms outlined may have COVID-19. The symptoms include cough, shortness of breath or difficulty breathing, fever, chills, sore throat, new loss of taste or smell. Other less common symptoms include gastrointestinal symptoms like nausea, vomiting, or diarrhea. Always seek emergency medical attention if someone is showing any of the following symptoms, such as trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. If you are experiencing any of the symptoms, please contact your healthcare provider. For additional information on COVID, please dial 211. If you decide to go to a testing center, please be aware of the following, such as the screening criteria, the operating hours, if you need a referral from a doctor, billing, insurance coverage, type of test offered, and how you'll get your testing results. For testing locations, please use the link in the description box. The tips to avoid exposure include: avoid close contact with people who are sick. And as a general norm at the moment with any other individuals who do not reside in the same household as you, please continue to follow social distancing guidelines, such as keeping 6 feet apart. Avoid touching your eyes, nose, and mouth, especially when out in public areas. If you are sick, please stay home. If anyone in your primary household is experiencing any of the symptoms or have tested positive, please self-quarantine. Cover your cough or sneeze with a tissue. Clean and disinfect frequently touched objects and surfaces. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap or water isn't available. Always wash hands with soap and water if hands are visibly dirty. You may want to wear a face mask around others. The following slides will include some of the medical resources in the community. For a more extensive list, please contact your advocate. For this presentation, we will cover Parkland Hospital, the GAPE Clinic, the Center for Health Empowerment, and St. Vincent DePaul. As a member of Parkland Financial Assistance, you will be able to receive healthcare services that are medically necessary and are normally provided at any Parkland location. The services eligible for financial assistance include hospital care, emergency room visits, preventative care services, and medically necessary outpatient services. The services include visits to your healthcare provider, wellness exams, well child checkups, hospital stays, including room, meals, and nursing care, medical and surgical services, care for expectant mothers, emergency care, prescriptions, routine immunizations, mammograms, prostate screening, radiology and lab services, 24-hour nurse line access, and geriatric care. Who can apply for Parkland Financial Assistance? Patients must qualify based on information such as income in relation to federal poverty income level guidelines. For more information on this, please visit the Parkland website or contact them by phone. There is no cost to apply, and you can get assistance from one of Parkland's financial counselors. On the right side of the screen, you will see a screenshot of the first page of the Parkland Financial Assistance application. You can download and print out the application online to apply. The link will be included in the description box. You will need to gather important documents when submitting this application, such as the proof that you live in Dallas County, valid photo identification, income, and the number of people in your household. You can also view the required document list online, as well as the clinic locations. Parkland Financial Assistance Program phone number is 214-590-8831. They are open Monday through Friday from 9 a.m. to 4 p.m. They are located at 5201 Harry Hines Boulevard on the first floor of Dallas, Texas, 75238. This next slide goes over the GAPE Clinic. The GAPE Clinic is a nonprofit agency whose mission is to provide quality healthcare services unconditionally to unserved people. All services at GAPE are free of charge. However, if you are able to provide a donation, this will greatly benefit the agency and the services that are being provided. In response to COVID-19, some of the procedures at GAPE have changed. Currently, Agape is seeing medical patients by appointment only. They are taking new patients, however, you do need to call prior to make an appointment. Please call 972-707-7782, extension 301 for medical appointments, to schedule an appointment or to order medication refills. All visits are being done by telephone. Please do not go to the clinic unless you are instructed to do so. Agape does provide dental services as well. However, due to county restrictions, dental is only able to treat emergency patients at this time. If you are having severe pain or swelling, visit the clinic between the hours of 10 a.m. and 1 p.m., Monday through Friday. Please remain in your vehicle until you receive instructions from a staff member. If you need financial assistance covering your prescriptions that the clinic does not carry, Agape Clinic has partnered with AIDS Healthcare Foundation and may be able to help you. Please contact Agape for additional information on any of the services that they offer. Agape Clinic is located at 4104 Junior Street in Dallas, Texas. Zip code is 75246. Again, the telephone number for Agape is 972-707-7782. The medical extension is 301. The dental extension is 302. For this next slide, we will be going over the Center for Health Empowerment. The Center for Health Empowerment specializes in sexual health wellness. They offer educational services and FDA-approved medical treatments at little to no out-of-pocket cost. Everyone is eligible for services at the Center for Health Empowerment, and no one is ever turned away. The Center for Health Empowerment Wellness Clinic provides PrEP, or pre-exposure prophylaxis, which is an HIV prevention strategy in which HIV-negative people take an oral pill once a day before coming in contact with HIV to reduce the risk of HIV infection, and PEP medications. PEP is post-exposure prophylaxis, an HIV strategy in which HIV-negative people take anti-HIV medications after coming into contact with HIV to reduce the risk of HIV infections. In addition to the PrEP and PEP medications, they offer STI screenings, prevention, and treatment in continuing care. The Center for Health Empowerment offers free confidential testing for STIs such as chlamydia, gonorrhea, and syphilis. They also offer free confidential testing for HIV. The Center for Health Empowerment works with community partners to help eligible participants find community resources for transportation, housing, mental health, and substance abuse. You can set up a confidential appointment by informing your advocate that you are interested, sending the Center for Health Empowerment an email at hello@checlinic.org, or by calling them at 512-840-1273. The Center for Health Empowerment has two locations. One is located at 2929 Martin Luther King Jr. Boulevard in Dallas, Texas, 75215. The second is located at 2500 West Pleasant Run Road, number 100 in Lancaster, Texas, zip code 75146. Please make an appointment prior to going to any of the locations. The next resource is for those who need assistance covering their prescription medications. St. Vincent DePaul does not carry all medications. Please contact them at the number provided to see if they carry your medications, or go online to their website. They have an extensive list of medications they carry. However, supply is limited, so they may not always have it. Again, St. Vincent de Paul offers free prescription medication for those without insurance. Due to COVID-19, St. Vincent de Paul is not currently accepting paper applications. I have provided a screenshot of what the application looks like. This application is available in both English and Spanish. You can submit the application by fax or by email. Applications can be emailed to cchavez@svdpdallas.org. If you have any questions, you can reach St. Vincent de Paul at 469-232-9902, Monday through Friday, 9 a.m. to 2 p.m. Safety planning around medical appointments. Tips on how to stay safe when going or setting up appointments. Here are some safety planning tips. Please remember that these are only tips, and always take your own situation into consideration. When going out in public, try to avoid areas your partner works at or hangs out in. Please always be aware of your surroundings. Park in well-lit areas. Check the front and back seats before entering your car. Keep your doors locked when you are driving. Protect your health information by password protecting your medical information. No matter who calls them, nothing about your medical history or appointments will be discussed over the phone unless the person calling can provide the correct password. The word you choose should be something ordinary and easy for you to remember, but not something your partner would guess on their first try. Under HIPAA, you have the right to keep your medical information private. If you're ever concerned about your doctor's office may have violated any of your rights, you can file a formal complaint with the Office for Civil Rights, your state's medical licensing board, or the Better Business Bureau. If you're concerned that your abuser may be checking your phone, delete conversations and use browser in private mode. Have a safe person that you can contact if anything goes wrong. Write down important phone numbers and keep with you in case you do not have your phone with you. Keep all of your important documents with you, such as social security cards, passports, identification, and birth certificates. For safety planning that is unique to you and your situation, please contact your advocate or call our hotline at 214-946-4357. Thank you for watching, everyone, and we hope to see you during our next Genesis webinar. For additional information on medical resources, please do not hesitate to ask your advocate.